Okay, this also is a fellow, Dr. Yin, who unfortunately came to the U.S. on a passport that does not allow for European visas. So in this work, she noticed in studying patients with autosomal dominant polycystic kidney disease, a disorder in which the kidneys are gradually destroyed by hundreds of cysts that enlarge, making the kidneys bigger and destroying the renal parenchyma. Two patients presented, one a pregnant female who on her way to work got out of the car and just collapsed on the ground. In her 8th month of pregnancy, was rushed to the intensive care unit and quickly delivered, was found to have a cyst compressing the IVC. And then another patient, this patient, who presented with deep venous thrombosis of the calf and popliteal vein, but no other risk factor. And here you could see in this patient, the IVC is severely compressed. And here also on the axial view, an almost slit-like IVC. And below the site of compression, the IVC is expanded, bigger than the aorta from the increased pressure caudal to the IVC stenosis. Here's that same patient where you could see the normal flow in the popliteal artery and then the clotted popliteal vein. Here's the normal flow. And we see it doesn't compress. And 4 months after anticoagulation therapy, the flow in the popliteal vein is restored. Here is the other patient I discussed that before pregnancy, the IVC was wide open, but some of these cysts in the liver were stimulated by the pregnancy to grow and are now compressing the IVC. Here, a slit-like IVC as compared to pre-pregnancy. And here again, on some more axial slices, we could see that below the site of stenosis, the IVC is dilated. So this indicates that it's a extrinsic compression which is hemodynamically significant. And again, she had to be emergently delivered and did well afterwards. So Dr. Yin looked at 216 patients who have this autosomal dominant polycystic kidney disease who are participating in a research registry at Cornell. And she compared to age gender matched controls with 3 blinded expert observers grading the IVC as no stenosis or mild compression or severe compression, and also measuring the IVC at the stenosis above and below, and measuring the degree of IVC circularity as well as looking at the number of cysts and other parameters and lab values and so forth. Here we have typical appearance of the IVC in a normal person, which tends to be flat and oval, whereas the aorta, which is pressurized, is round. And so this can be characterized by measuring the long and the short dimensions. And here in a patient, you could see with enlarged kidneys and the IVC is compressed more superiorly. When you measure the long and short dimensions, you end up with a number that's close, a ratio that's closer to 1. So a large right-left to AP ratio indicates a flat, low-pressure IVC, whereas a smaller, closer to 1, right-left to AP diameter indicates a more circular, higher-pressure IVC. So we looked at a lot of parameters between the ADPKD and control subjects, but I want to point out that in 66 or 31% of the ADPKD subjects, there was compression of the IVC, but none of the controls. And in those ADPKD subjects, you can see, for example, this ratio of circularity of the IVC showed a more circular, closer to 1 ratio in the more severe degrees of compression, especially compared to no compression or mild compression. And also, when we look at the area of the site of maximum narrowing, it's much less in the ones with severe compression. So she also looked at what factors contributed to IVC compression using a multivariate linear regression analysis. And here, another patient who was pregnant, and the pregnancy stimulated the growth of the hepatic cysts. And here, just looking at IVC compression in the intrahepatic region, and here in this patient, you can see again the IVC is slit-like. Below the IVC compression, it's dilated. And here it is on T2 with very slow flow and bright signal instead of the normal black flow void. And again, dilated down distally at the site of the aortic bifurcation. So female gender and liver cyst fraction were highly predictive of IVC compression, and that makes sense because the female's hormones are stimulating the cyst growth in the liver. Now, if we look at the IVC compression by renal cysts below the liver, and here's an example here where the right kidney is very enlarged and cystic, and that cyst is displacing the common bile duct medially, and it's also pinching the IVC, and here the iliac veins are dilated. In this case, the size of the kidney, height-adjusted total kidney volume, and the degree of circularity of the IVC were highly predictive of presence of IVC stenosis. So in conclusion, 31% of ADPKD patients have IVC compression from extrinsic mass effect of those liver and renal cysts, with severe compression being associated with 6% major complication rate, including DVT and circulatory collapse. In general, our observation was that this is underappreciated by radiologists because none of the reports in these patients mentioned anything about a compressed IVC. Thank you very much.